the last topic we have before we open it up to questions and answers, hopefully from our attendants, is about the variants, because, you know, you and I both know we are not out of this pandemic, not in the US and definitely not in the world. And I shudder to think about the lives that will be lost around the world while we are opening up like everything's fine. And this is not true. This is just not true. So as we know that the recent COVID is an RNA virus, which I've talked about before, which means that it's not corrected when it's reproducing and something goes wrong. Well, if one of those changes, one of those errors in the genetic material is something good for the virus, that virus is going to take over. And that's what we've seen with what used to be called the B117 or the P1. Now the World Health Organization has given them Greek letters. So the Alpha variant was the one that was originally found in Great Britain and the United Kingdom back in December, called B117. And that's what blew through Michigan back in January, February, March. And now we have other variants. And now the Delta one is what was recognized in India that caused a surge a few months ago that was just so devastating for people in the country of India. And then that's not it, right? Those are CDC variants of concern, meaning that we're watching those, we're making sure we're tracking those, but variants of interest. These are all other ones that are out there, and any one of these could be more devastating. For example, Delta is about 40 to 60% more transmissible. What does that mean? Can you explain that to people when we say Delta is more transmissible than Alpha, which was more transmissible than the original one? And how does that really affect you and me?
Right. So I think this is really important. You know, we've talked about this so much previously with the Alpha variant, and we were really concerned because it was more transmissible. And we did see this in real time. You know, in November, my hospital started, flooding again with COVID patients. And it was because, we knew that the Alpha was going to be the predominant, variant here. And because it was more transmissible than the original wild type virus, people were essentially exposed, where they needed less time of exposure to contract the virus. And
so if before I had to be in the presence of some space that had virus for 30 minutes or 40 minutes, now with the Alpha, I could be in that space, in that room with somebody who's putting out virus for 20 minutes, and I could breathe in enough to get myself infected if under the circumstances.
Exactly. And what that means in numbers is that when you have something that's more transmissible and it's easier to contract, you're going to have more people be affected by it. So, and that's what we saw, in the fall and winter of 2020, our major surge that we had then, and we saw it play out. And now, the concern is that we have a Delta variant, which is even more transmissible than the Alpha variant. So we already know, what happened with Alpha. And now with Delta, we're seeing it globally, what's happening there. And we know that the doubling time is pretty short, and our percent of cases are primarily from Delta now. And we know it's going to be the main variant, globally, but even in the US very soon. So what that means is that, it's going to take even less time, even less exposure for people to contract the virus. So something that you may have felt safe doing, previously may not be safe anymore. So, so those are the things that we have to think about. And especially when you have people that are not vaccinated, and we know that the pediatric population, children are not vaccinated. We know people who have conditions which suppress their immune system, and there are medications for that. They may have been vaccinated, but the vaccines are not really giving them that immunity that a normal healthy person would have. So they are essentially considered unvaccinated and high risk. And then you have people, and no vaccine is 100%. These vaccines have been proven to be very close to that and really good and effective against all variants at this point. But nothing is 100%, so you're still going to have those cases, those breakthrough cases. So it's a matter of Russian roulette, and how much risk are you willing to take? And when you have a virus that's as lethal as this virus and you don't have a cure still, I'm still seeing patients, that come in that get put on a ventilator or in the ICU. And I don't know if they're going to make it. And there's most likely they're not going to. And at this point, this is a preventable disease. And, it is so upsetting to lose any more lives when we have something now that we didn't have last year. We have something that we can prevent this virus and this degree of, disability and death, and we can save lives. So, that we have to focus on that.
And I think about also our children, that they cannot get the vaccine, but if we reduce the transmission in the adults by getting vaccinated, or at least the disease and hopefully some of the replication, we have less virus circulating. We want it to be less than 3%. So I think, oh, go ahead.
Sorry, I'll just say that on the children, I do want to highlight a point really quick that, again, back in the first wave, we saw significant, especially in New York, significant amount of children that were affected by the multisystem inflammatory syndrome in children. And so
wait, don't run past that, because that is not talked about. When we were at the last FDA meeting, we talked a lot about myocarditis, which is seen in people who adolescents who get the vaccine, but the multi-inflammatory syndrome in children, which is showing up, I think about 60% of the children who get that are children of color. Can you talk about that just a little bit?
I was just going to say exactly that during our first wave, we saw, 4 to 6 weeks later, the impact on these children. All of a sudden, the pediatric population was getting hospitalized, and we were learning new things every day. And we were just realizing that these patients, the syndrome that it was, how to identify it and how to treat it, because it was different. But these children who are generally healthy were coming to the hospitals, needing to be hospitalized, needing ICU at times, needing these medications to really help treat them. And it's very scary. You want to try to protect children as much as you can. And primarily, again, the children who were affected were, again, the children who were from these communities that were most marginalized, the Latinx population, Black Americans, African Americans. And it was just, I think you see the MMWR report from the New York data, just shows it clearly. The numbers are all there. And the concern is that when you have high levels of virus, transmitting in the community, where you might have pockets, different states in the US. Again, we haven't reached, levels of, herd immunity in our nation by any means, but there are definitely areas in the country where, there's more vaccine uptake and areas where there's less. In those areas, when Delta starts taking a hold, which already is in certain places, in certain states, the impact on that may not just be in adults. We have to remember that this inflammatory syndrome exists in children as well. And children, again, are not yet vaccinated. So,
they won't be anytime in the near future. When school starts back in August, September, I don't think our children under 12 are going to be vaccinated. And that really concerns me. This is not a virus that says, oh, I prefer adults. It will reproduce in whoever it can get to. And if the concentration of virus becomes higher among children, then some proportion of those are going to show up with disease. So we need to get people vaccinated to try to keep that pattern from happening, in addition to the variants that still might be coming forth. So we've got a lot of work to do.